Hi, I'm Lee Ehrenberg, and I'd like to welcome you to another event of The Living Room. The following program was recorded at the Santa Monica Public Library and is brought to you in collaboration between the library, the Friends of the Library, CityTV, and the California State Library. Now sit back and enjoy.
Our presentation is Managing the Emotional Chaos and Crisis of Caregiving, and I'm going to speak briefly about the caregiver. So let's start by defining who a caregiver is. So the term caregiver refers to anyone who provides care to someone who is in some degree unable to care for themselves, either temporarily or permanently. Informal caregiver, or family caregivers, are terms for unpaid persons such as family members or friends who provide care for another person. And as you all probably would imagine, few people seek out the role as caregiver. So here's some stats about caregiving. I thought this was really interesting. Nearly 1 out of every 4 households in the US, that's 22 million households, cares for somebody over the age of 50. 80% of all long-term care is provided by informal caregivers, so these people aren't paid again. If we paid these informal caregivers, it would cost $375 billion per year. How many of you guys in the audience are or have been caregivers? A lot, okay. So most people actually don't realize that they have been caregivers because they see themselves as just helping a friend or a family member. In your packets, if you got packets, if you haven't, if some of you guys were here nice and early, there is a packet of our presentation, and there is an outline of Judith and I's talk, as well as some handouts. And in the handout is a caregiver questionnaire. So if you scan that, it's right after the handout of our outline, you'll see some caregiving tasks. And I'm just going to kind of go over some of them really briefly. Some caregiving tasks are taking the care recipient to the doctor, taking them to social events, doing shopping for them, helping manage their finances. So that's paying bills, maybe receiving the bills at your home, going to the bank for this person, helping with activities of daily living. And activities of daily living are help with cooking, cleaning, grooming. There's the daily telephone support, and those who have been caregivers know about the daily telephone support, especially people with early memory loss. You could be talking to the person 5 up to 20 times a day, some of my caregivers report. And then there's always acting as that person's advocate. So if you have done any of these tasks, you are a caregiver. So now, how many of you guys are caregivers? A little bit more. Okay, good. All righty. So let's move on to the subject of caregiver burnout, because I think you guys understand what a caregiver is. Often, while caring for a loved one, caregivers often stop taking care of themselves. Caregivers often experience a great amount of stress, both emotionally as well as physically. And some of the most common physical and emotional problems in regards to caregiving, the first one is poor health. Caregivers have more health problems than people who are not caregivers. Illness and injury. More than 1 in 10 caregivers become physically ill or injured as a direct result of caregiving. This is really interesting. Caregivers reported more unhealthy days, 6.3 compared to non-caregivers of 3.7 a month. That seems like an awful lot, but that's the average. Caregivers have an increased morbidity and mortality rate. One study found the death rates for caregivers was 63% higher than for non-caregivers. Caregivers have to deal with chronic stress, which are risk factors for high blood pressure, diabetes, heart attacks, poor immune system, and of course, anxiety. Caregivers can experience caregiver burnout. And caregiver burnout is defined as a state of physical, emotional, and mental exhaustion. And there are so many symptoms with caregiver burnout. There's altered eating habits and sleeping habits, overreacting, so not being, when something kind of goes wrong in your life, instead of just kind of going with the punches, when you have caregiver burnout, you just can't. You kind of go off the handle. There's a sense of guilt. You might not be able to laugh or feel joy. There's the loss of compassion and the feeling of helplessness. There's resenting of the care recipient or the situation. Oftentimes the caregiver isolates. There's emotional withdrawal, inability to concentrate, forgetfulness, anger, and crying spells. So those are all symptoms of caregiver burnout. Caregivers deal with more family conflicts than non-caregivers. And there's an increased misuse of drugs and alcohol and depression. And in the caregiver burnout, that sort of is a definition of depression in my mind, but approximately 45% of caregivers suffer from clinical depression. And this is also very interesting. Early placement of the person being cared for in a facility setting often happens with caregivers because they're not taking care of themselves and they can't take care of their loved one. So in your outline of what I'm talking about today, there is a narrative which is comparable to the stress that is associated with caregiving, and I'm going to read it out loud. A doctor was giving a lecture to an audience about stress management. She raised a glass of water and asked, "How heavy is this glass of water?" Answers ranged from 20 to 50 grams. She said all of these answers were wrong. The absolute weight does not matter. What matters is how long you hold the glass. If you hold it for a minute, it's okay. If you hold it for an hour, you will have an ache in your arm. If you hold it for a day, you will need to call an ambulance. The weight of the glass is the same, but the longer you hold it, the heavier it becomes. If we carry all our burdens all the time, sooner or later, we will not be able to carry on. The burden becomes heavier and heavier. What you have to do is put the glass down before picking it up again. So I think this leads nicely into Judith, and Judith is going to talk about how to manage caregiving, because I just gave you all the nasty, ugly stuff about being a caregiver. So, Judith?
So I'm going to be the bossy person and tell you how to manage this. Welcome and to all of you here today. So how do we manage caregiving? One of the first things that we need to do is we need to get ourselves educated. We need to get educated on treatment options, progression, what really is the disease, what does it mean, the diagnosis that we've gotten for our loved ones. And this might mean going back to the doctor. I think when most of us get diagnosis for our loved ones, we're in shock, we don't know what to ask. A doctor may talk in a language that we don't understand, or we're kind of in denial, so we really aren't going to hear anything that they have to say. So it's important to go back and understand the disease itself, and it may be meaning to go back to the doctor. You need to know what to expect in the future. What do you need to prepare for the future? What resources are available to you and are appropriate for your situation? What we need to do is to ask questions when we don't understand. I suggest that what you do is before you go to the doctor, you have made a list. When you're caring for someone, a problem arises and you think, I need to tell the doctor about this or a behavior or whatever the situation is, keep a notebook and write those questions down as they occur. Before you go to the doctor, get a sheet of paper and write down the questions you have for the doctor. And give it to the receptionist or the nurse and ask them to give them to the doctor. And if you could talk to them after. Often what happens when we take our our loved ones to the doctor talks to us and not them. In cases of people with a dementia, they can get very, very angry and say, nobody's listening to me, why aren't you talking to me? This can avoid the issue. You can't always say the things you need to the doctor in front of your loved one also. I used to take my father to the doctor and could take him, and he would be complaining and he'd be bleeding internally, and we'd get in the doctor's office and the doctor would say, how are you, Norman? And my father would say, oh, I'm fine. I'm doing good, thank you. How are you, Dr. Jones? Well, if I wasn't there, my father would have walked out not having anything taken care of because he felt fine at the moment because he was being helped and he had people around him. We need to plan ahead as soon as possible on legal and financial and health issues. How many of you in this room have powers of attorney for whoever you're caring for? How many of you have powers of attorney for yourselves? Okay, not a lot, not all of you. Those of you who don't have power of attorneys, does anyone have a question about what a power of attorney is? Well, I will explain just quickly. There are two types of powers of attorney. There are powers of attorney for health and for finance. Finance is a power of attorney where you turn your situation over or in conjunction with yourself, where the person you're naming can help pay the bills, do banking, make investments, etc. All this has to be done, and it becomes effective immediately, and it needs to be notarized. A power of attorney for health is a little different. Nobody has to notarize it. Two people have to witness it. But what this power of attorney does, why it is so important, is that it gives you the power, if your loved one becomes incapacitated, to make decisions for them. Until two doctors deem this person incapacitated, they have all the power that needs to be, and you have none. What would happen, though, if you don't have a power of attorney, even for yourself or for your loved one, and a situation came where you were incapacitated, you need to conserve that person to be able to make decisions for them. And this can cost $5,000 to $10,000. Not only that, in the case of someone with a dementia or a frail elderly person, often they need to go to court in front of a judge so the judge can also say that he feels they are incapacitated. It's important to get your support for your networking, to get help for yourself. Often it's hard for us to talk to our children or our families about what kind of help we need. Some of us seem to want to carry the burden. When Nicole and I talk, I'm going to tell you how I was a martyr for years. You need to take care of yourself, as Nicole was talking about. You need to take care of yourself as a caregiver physically. You take your loved ones to the doctors, but do you go to the doctors? Are you taking care of yourself health-wise and eating right and getting enough rest, which isn't always easy? Mentally and emotionally, we need to be able to talk to people, have ways of letting out our frustrations. We need to take time off and make my time. This is part of asking for help from families, which we really need to do, and often it's hard for those of us who have children. I always think my children are very busy. They have families of their own. I don't want to ask them for help. They want to help. They just need to know what you need. I used to have families that would call me and say, well, I've asked my children for help, and they said, well, they couldn't come because it was their son's soccer tournament. So they never asked again because they felt rejected. And trying to work with families, I tried to get them to understand you need to just ask. You know what happens in being a caregiver and caring for someone, the emphasis goes on the person who is ill. And all the family rallies around for that person, but they don't necessarily rally around for those of us who are caregivers. The last thing is positive thinking. How we think positively or negatively affects our behavior. There are handouts in the other room that will talk to you about positive thinking. But I'm going to read you a little poem I found a few years ago that is about positive thinking. It's called Attitudinal Adjustment. Since my husband's illness, she said, my house is such a sight. I wipe and wash it clean, but still it isn't right. Fingerprints on the furniture, the woodwork and the walls. You can see where he's been if you look at all the halls. Patting her hand gently as I heard her tale of woe, I gave her my suggestion as which way I would go. You cannot change your husband. He didn't want to be this way. Look at things a little differently. It'll make a brighter day. When you're looking down the hall, picture a musical staff, horizontal lines with notes that should give you a laugh. Then when he goes along the wall, do you know what he will do? He'll be writing musical love notes to you. The next time I saw her, she smiled and said to me, I know my husband loved me. He just composed a symphony.
We're going to begin now. We're going to shift gears from sort of our lecture format, and I'm going to be facilitating an interview with Judith Delaney. As you know from the wonderful introductions from Sue, Judith is a professional who specializes in aging issues for individuals, families, and couples. But Judith has also been a caregiver. And we thought it would be really interesting to hear from a professional who has been impacted by caregiving, even with her extensive case management, clinical background, and expertise. So, Judith, who were you a caregiver for, and what were your roles exactly?
For 12 years, I was a caregiver for 4 parents. 3 of them had dementia. 1 had Alzheimer's disease. 1 had dementia due to Parkinson's disease. And my mother had a dementia that was caused from an operation where they went in to suppress a nerve in her brain, which made her brain turn to mush. And then there was my father, Norman, who was cognitive, but an angry person. So my responsibilities for caregiving initially were traveling to 200 miles every other week because my father would get ill or something would happen to my mother, and in a panic mode and have to go and take care of them. After that, as time went on, my parents or my in-law parents never did live with my husband and I, but our responsibilities were still very, very heavy in what we did.
Okay, thank you. Did you experience caregiver burnout? I doubt you did because, you're professional, you know how to handle this, you're lecturing on it.
Well, I don't like to think that I burnt myself out. I call them crisis, and they were crisis. At one time, my sister, I have a sister who is a few years younger than I am, who didn't really get along with my father, so she didn't want to play any part in the caregiving of my side of the family. So she would never go on my little once every 3-week sojourns to my father's cry of help that took me 4 hours to get there. At one point, my father-in-law started becoming abusive to my mother-in-law because of her dementia, and because she had forgotten how to set the table, and she'd forgotten how to do things, and this angered him terribly. So we had to put him into a board and care to separate them. So we had him in a board and care to remove him from the, abusive relationship that he did. At the same time, my mother-in-law became so paranoid, I had to have her hospitalized at Century City in a psych ward to get her medications because she just was accusatory and angry from a lady who had been so kind for so long. At the same time, during this period of time, my father had triple bypass surgery. And the way I found out about the triple bypass surgery was that at 1 o'clock in the morning, I got a call from two of my parents' friends where they lived outside of Bakersfield, and he said, "We're at your mother's and dad's home. We've been at the hospital all day with your father. They think he's going to have bypass surgery, but we've brought your mother home, and the hospital wants you to call them tomorrow." My mother had dementia. She was incontinent. She couldn't dress herself. She couldn't bathe herself. And they're going to leave my mother in her home by herself 200 miles away. So I said to them, I need you to get my mother in her pajamas. I need you to see that she goes to the bathroom. I need you to put her little dog in there and give me the phone and let me talk to her. And I said to her, now, you're just going to stay in bed. It's okay. I'm going to be there as quick as I can. And don't get up out of bed because she had also broken her hip a couple years before, until I get there. So that was fine. I thought she could do that until I got there. I get off the phone and I'm thinking, I have to have some in-home help. I didn't know what to do. I just literally froze and had no idea who to call or what to do. So fortunately, I had the cell phone of a very good friend and business associate who was an in-home help agency, and I called him and I said, I don't know what to do. He said, it's all right, Judith, calm down. I'll give you the number of an agency. Called the agency, and they met me there in the morning. Lots of times, I realized that after this happened, the next day another situation happened where I had to put my own mother into have her evaluated because she was very fearful and very, 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 how do I want to say? She really had more a psychotic break and was very afraid and thought when my father walked in the house, he was someone else and wanted to stab him with a knife, unfortunately. Well, getting everybody up there, to get her into a psych ward because my mother because of her fears, she didn't want me to be involved. So my sister called me one morning and said, Mom has, tried to stab Dad. He put her in the hospital to take her to the hospital, which is about 50 miles away, and she tried to jump out of the car. I said, well, I'm calling him right now. No, they don't want to talk to you. And I said, pardon me, this is BS. I'm gonna call them. Before I called, I had all their numbers in Bakersfield. Got a hold of the hospital. They gave me a psychiatric place where I could take my mother. Called my father. He said, yes, she was okay. He could get her there. Got her there, met my father. We got her in. At the same time, my sister, who doesn't like to do anything, shows up and says, well, I'll buy pajamas and I'll get Dad a place to stay. Well, I realized that night on my way home after I got my father into his hotel room that as I was driving home, it felt like I was sitting on a generator, that my car was just vibrating. I pulled over and I realized it wasn't my car, it was me. It had such an effect on my body going through this, even though everything I handled very, very well, that I realized I couldn't drive the rest of that 150 miles home and pulled to a motel and stayed. So these are some of the things that I call them little crises, and they probably were burnouts. So many things would happen along the way. I remember one day I went to visit my father when he was in a board and care, and the lady who owned the place said, "Your father has to go to the hospital." And I looked at her, and I started to cry, and I said, "I can't do it." Not even thinking that my husband was with me and he could take me. But there was nothing. If he hadn't been there, I don't know what. Even though I am a professional, I know what to do, I know the resources, I know where to call. After a while, it gets to us, and it affects us all in different ways. You probably all have stories that you can tell me that happened to you.
Judith, you didn't mention this, but we were working together at your parents, that it was their end of their lives, and you were gone a lot from work, and we have a very nice, flexible work environment where they were understanding of that, but you missed work because you were the person here. So you were running to the valley constantly, if I remember.
Oh, yes,
So
yes.
that was another way that you were impacted by, as a caregiver, too.
Oh, absolutely, because you have to realize my office was across from Los Angeles County Museum. My parents lived 200 miles away. I mean, the whole day was gone, and sometimes I had to stay for other days. Yes, I lost a lot of work also, which is very common for caregivers.
Thank you. So how did you tackle the burnout? How did you tackle these crises, when you were melting down and your husband probably looked at you going, "You're a professional, you can manage this, Judith."
Right.
What did you do?
Well, I have to tell you, and probably unlike a lot of you sitting here, as I said, none of my parents lived with my husband and I. I didn't have day-to-day, minute-to-minute, hour-to-hour care. That was one thing that helped. My husband, at the initial part of all four of them needing care, traveled a lot and was out of the country most of the time. So it was quite different. My husband then quit that job, and retired, and so he started taking care of his parents, and I took care of mine, so it made it a lot easier. They both eventually we had to get a couple to live with my in-laws, so that they could take him to the doctor, they could buy the groceries, they could do all the things. My parents ended up in a board and care because that was the only place they could be because of my mother's dementia, even though my father was cognitive. So a lot of the emergencies and everyday things really kind of gotten taken care of, but we were very lucky because not only could we afford to, which a lot of people could not do. So my caregiving and my crisis that I went to, I had so many advantages that other people don't have. So one of the things I did also, I have to tell you that I am a firm believer of, was, I know people at work would get tired of hearing me talk about it, and I really didn't want to talk about it. It was bringing it up, and it was keeping me kind of out of my own denial, and it was renewing everything. So I would tell them in humor about what would happen. And I'll give you two examples. When my mother-in-law was in Century City in the psychiatric having her medications done, I would go and visit her every night, and she would say to me, "Isn't this a lovely cruise ship? I just love all these new people that I am hearing and meeting, and the food is so good here. It's fabulous." Well, as soon as I would leave, and they would put her into her room, every night my mother-in-law weighed 90 pounds. She had the ability to pull her bed in front of that door so they couldn't get in it. And they would laugh. They'd say, well, they could finally get in. My own mother, when we had to have her evaluated, my mother's a very short little person and very, very chubby and walked with a walker because of her hip. And every night, they would tell me she would get up and she'd have her nightgown on and walk with her walker and her purse on her arm, and she would say, "I'm just going for a little walk." And it was a long hall down, and they could see her, but as soon as she got to that hall, she could round the corner, and she would start to push that walker faster and faster because she was going to get out that door. You know, so many things that happen with our loved ones, it's not laughing at them, but it's finding some kind of humor in what's happening. Because, you know, if we can laugh, we can't be sad at the same time. So those were some of the things that we did in burnout.
That's very good. That's similar with my family. My in-laws have not been very well, and we have had many issues where my husband's family lives in Illinois. So we're very far away, and he gets very stressed out, and we have to use humor in many cases. And my humorous story is that my in-laws live in a very small town, and they know everybody. The place that you go every day is the Walmart. And they do not like to call the ambulance when they need help. And they really need help. So my mother-in-law has fallen many times and she's unconscious, but God forbid you would call the ambulance because you don't want to wake up the neighbors and let everybody know. So Chris and I often laugh about that because it kind of breaks up, you know, the stress. So those are good examples of how you take care of yourselves. The other thing that I do is, because we're not there, but his siblings live there, is that when we visit, we try to take on some responsibilities in terms of maybe cooking for them and putting food in the freezer that they can bring out. I'll try to take my sister-in-laws out and we get our nails done, or we go out for nice meals. Again, we live far away, so when my in-laws could, they're not able to now, they're now placed in an assisted living, but we would send them Red Lobster gift certificates, and so that they could go out and eat and we wouldn't have to worry that they weren't getting food, and we figured that would be also a social situation. So even if you're a long distance caregiver, you can help in some ways too. Yeah.
I'd like to say one more thing. This is being taped. And if my sister comes to this library and gets this tape after what I said about her, I have to tell you, actually, when I said to you up here that I was a martyr, I did ask my sister when it was time to go and help me, and she'd say no, she wanted to work. And I never pushed it until one day I had to go up there, again, very late in the night. And she said, no, I'm going to work. And I said, you will get in this car. I'm driving by your house. I'm going to pick you up and you're going to go. My sister did. Eventually, when I really asked her to help, did help. I did all the emergencies and the doctor's visits and every crisis, but my sister did all the financial work, investing their money and doing all of that. And that in itself was such a help. That's what she could do. And she would have always done that if I had not been a martyr and say, well, I'm doing all of this. So that's when I talk to you about asking families. Don't think you can do it all. And families really are able. So my dear sister, I'm apologizing.
Sometimes with families, you do have to you have to tell them what you need, though, from them. You know, I'm having a really hard time driving my loved one to the daycare or to the senior center. Could you do that on Fridays after you drop your kids off at work? I can't, I'm not a good cook. Do you mind making a lasagna or something a couple times a month so that we have food in the fridge? Most people do want to help, they don't know how. So if you give them some ideas, they'll be useful to you and they'll feel good about it. All right, Judith, you kind of brought some of this up, but what community resources were helpful to you as you went through this process of being a caregiver to all these people?
Actually, every one of them. In-home help, I used adult daycare. 2 of my parents went to adult daycare. Placement agencies were fabulous and gave me names of Boardandcares.
Can you tell me what placement agency, I know what they do, but for other people, what do placement agencies do? Do they cost money? What do they refer us to?
Placement agencies do not cost anything. You can call, you tell them what you're able to spend, where you want it, about the person that you want to place. And what they do is they go through their list and they give you a list of places. They do like to ask you a lot of questions because they want to be sure that the place is right for you, which I think is very important for caregivers to know that somebody cares about their loved one. There is no charge for this to the family whatsoever. So, and they're absolutely wonderful. They do go and visit them. They know their health records. They know the standards that they have, and they know them personally. So they're going to give you the best that they can for what your needs are.
Are there other community resources that you utilize? Like did you use any of community service providers, not necessarily adult daycares or assisted livings, but maybe organizations that offer support?
Well, being the clinical director of the Alzheimer's Association, I had at my hands a lot of knowledge, a lot of resources and so forth. Support groups were another one. I never myself attended a support group, but conducted and led a support group for 9 years, which in itself was fabulous for me, because all the things that I learned from 4 different people who I was responsible for, I could understand where people were coming from. I could understand why they were afraid, where their fears were. And it was the same with my job. All of my experiences really helped me, and I hope I helped the families that I dealt with because I could really, really understand.
Thank you. So Sue, do you have any questions to start us with?
Yes, I do. There is an assumption is underlined, that the doctor is there to help, be it for either the patient and or the caregiver. What if this is not the case? And then there's an arrow that says, due to the doctor's lack or absence of time, lack or absence of interest, lack or absence of positive attitude, lack or absence of standard of care, and or physician abandonment of case. Wow.
Ooh, wow.
And a note at the bottom that says, there is no second or other doctor waiting in the wings.
Do you want to answer that, Judith, or do you want me to?
Go ahead.
Okay. I think that unfortunately, and I apologize if there's any doctors out there, but I think that doctors are very busy, and our health system needs a lot of changing, and they don't have the time, or they don't give necessarily all the time that we require. So as the person, as the caregiver, or even as the person with the illness, it's important for you to be your own advocate. Ask for what you want. Go into those doctor's appointments prepared. One thing that I like to tell my families to do is to write out 3 questions, send it to the doctor ahead of time, and hopefully they will read it. You can fax it to them. You can give it to their nurse practitioner. Sometimes you can just fax it in if you have a small family doctor kind of situation. And hopefully they'll see it. Otherwise, when you get in, you say, I have 3 questions that I need to bring up with you, and kind of carve out that time so that they know that they're going to need to spend time with you. But you need to be your own advocate, and hopefully with our healthcare reform, maybe some changes, good positive changes will come. But it is a real struggle, and I think, for example, the Alzheimer's Association, we're working really closely to educate doctors about the importance of being more present with their families, and really giving the answers. And if they're not able to give answers, to say, why don't you work with an organization like the Alzheimer's Association, like Lisa's Place? Why don't you educate yourself about some of the support services? Because maybe the doctor can't provide that, but there are good organizations out there which can. Does that answer that question?
I would like to answer that question, but I would need more information from you, whoever wrote it, as to why there are no other doctors in the wings, why you can't see someone else, why there is no time, as Nicole said, to to give them some questions and meet with them. I think I'd need a little more information. I'm not asking the person who said that. There is also, as far as Medicare and Medi-Cal is concerned, there is an organization, and Bunny, I'm going to ask you the name of it. Lumentra. Who, people who have given, if it's an HMO, who have given their insurance for Medicare over to them, they have the same rights as somebody who has Medicare to be seen. I would think that you could contact this organization, depending on what the circumstances are. As I say, I'm not sure exactly how to answer your question, but they will advocate for you. And if you need that number, you can see either Nicole or I after, and I don't have it with me, but we will certainly be sure that you get that number that you can call.
Thank you both. We have several questions. The next one is, why would a person need power of attorney for themselves?
Great question.
Wow, what happens if you get in a car accident and you're unconscious?
Who's going to make your decisions?
Right,
And there you have the succinct answer.
right.
Yeah.
It's not just because we're older or we have or somebody has a dementia. It could happen to every single one of us. Go
Anybody
ahead.
who has kids, I tell my families that I work with, I'm a younger person, although I am older than I look, I promise. But what if you have children and something happens to you? Who's going to take care of your children? What if you have home and property? What's going to happen to that property? You need these legal documents. You need to be in control of the situation. If something happens to me, I want everything lined up. I'm a control freak. So that's why you need a power of attorney for health and finance, so that you have that plan all written out for other people to follow. The other thing is, if you are at the end of your life and you haven't put your wishes down, you are putting a big burden on a family member to make decisions for you. I don't want my family to have to guess, what did Nicole want? I want to be very clear with them, and even though it's a hard thing to bring up, say to them, this is what I want. This is the kind of care I want at the end of my life. It makes it very clear for my family members.
It does take a lot of the burden off of them. Here's a good one. How do you advise the caregivers in coping with the guilt of placing their loved ones in assisted living?
That guilt is very hard to get rid of initially, but I think what needs to be thought of is what really was best for that person. Could that person stay at home and get the care that they needed? The other factor of it is also, as I mentioned, the emphasis goes to the person who is not well. What happens when the caregiver has to do this because they can no longer physically do it? And so maybe that's somebody here in this audience that you've had to do that. You may feel guilty because now that you've done that, you promised each other that you would never put anybody in a home, never put them away, and now you've had to do it. It's the welfare of everybody involved. Sometimes placing somebody, if it had to be in a skilled nursing facility, could be covered by Medicare, Medi-Cal, and having somebody in the home doing 24-hour care, financially it might not be feasible for you to keep them at home. The guilt is going to be there, but if you can see where they are and eventually see that they are okay and they're doing all right and you're surviving, but nobody can take the guilt really away. It's something that I think you just kind of have to feel for a while until you realize you did the best you could and this was the right decision to make.
Another thing I tell my families who say, you know, I'm really worried about the guilt and I placed my loved one and I don't know how I'm going to live with myself, is that, you know, you're not going to just, I don't think, you're just going to place your loved one and never see them again. I hope that you're going to go and visit them. You're going to have meals with them. If they're in an assisted living, you're taking them out to the theater, to your favorite diner. You're going to movies with them, and you still have a presence in your life. I know it's really hard. I know that when you place somebody, it's a change, especially for spouses who've been together for donkey's years. But you know, you're still gonna visit them. I hope you're not just gonna say bye bye.
Thank you. And here's a tough one. Not that the others haven't been. What would you recommend if we call the main phone number of the assisted living residence in the evening and no one answered the phone after 17 or more rings? Mom wasn't answering her phone.
I would get in my car and go.
I was an administrator of an assisted living facility, and I would go, like Judith said, and then I would immediately make an appointment with the administrator, director of nurses, and be a presence in that facility and ask what is going on. There are situations where perhaps somebody has fallen or gotten hurt and there was an emergency, but I would get in there and I would be advocating for my loved one.
And I'm going to add one more thing to this. If that really is the case, one advantage of using an agency that does this kind of placement is then you have them as your advocate as well. And they want to know if you have run into this kind of situation. So please, if you've used any agencies out there, call them, keep them in your cell phone, wherever you are, and let them know that they need to look into this as well. Because the next time that it's time to refer, they want to know the history and the scorecard of the places they work for. So please share that information, and they can also be your advocate. How do you find a placement agency in Santa Monica?
Go ahead, Sue.
Well, I actually have another agency represented here too.
Oh.
That's what I do. And we represent Santa Monica, and we're very proud to do so. And then I also have up here in Bonnie here, who works for another agency. So you can speak with either one of us afterward, and we'd be glad to give you more information.
And the Alzheimer's Association, I'll do a plug for the association, we provide information and referrals, and we work with Sue and Bonnie, and we'd be happy to provide you referral to in-home care placement agencies, not to assisted livings. I always give placement agencies, adult daycare, so you can always call us and it's free of charge.
The next question is, how can we be more helpful to the ongoing research? Can we go to meetings on research?
That's really a good
It's a
question.
really good question.
And I have to say, I can't answer that.
Is Ashara in the audience?
She's out.
Out.
manning the-
Well, I would say that the Alzheimer's Association has free community events offered throughout the community, and I do have a calendar of events out there, and we do talks on research. There's a lot of great organizations out there. Lisa's Place, which is located in Mid-City, as well as Sherman Oaks, they oftentimes bring in speakers, wonderful speakers from UCLA, USC. So I think it's getting attached to an organization who can educate you about all sorts of great opportunities. I'm sure UCLA and USC does presentations as well about clinical trials, but it's a wonderful thing to get involved with. I applaud people who want to be involved in clinical trials and research and learn more about it.
I would guess their websites may have that information.
Yeah.
My HMO has an advanced directive, which is a complete form for healthcare wishes and financial too. Is this a legal substitute for a power of attorney, or is this needed in addition to the power of attorney?
Good question.
You know, I don't know. I'd have to look at it. It could be one that's if it's just specifically for them. But a lot of them are directives.
And we have someone in the audience who can actually help us with that.
Good.
Esther?
I'm an elder law attorney with Healthcare and Elder Law Programs. We're a nonprofit that provides information on the importance of powers of attorney for healthcare and financial matters. The one disagreement I have in that question is that when you get a power of attorney for health care, it is a legal document that you can change at any time, where you choose who your spokesperson should be. And when you sign that form, you're not giving up any of your own rights, your legal rights to stay in charge. You can always just tear it up and choose someone else. It's very different when you do a power of attorney for financial matters. If that is a document that takes effect once you no longer have abilities, it has to be a durable power of attorney for financial matters, and it has to have extreme specific information in there. It cannot just be a general document that says, I give someone else these powers. It has to talk about the specific rights you're giving up in terms of spending certain monies, making certain gifts, making certain loans, and in particular, when it comes to issues of nursing home care, even the possibility of doing what's necessary with transferring property so that it's possible for you to be eligible to receive Medi-Cal benefits for nursing home care. And one of the reasons we do advise people to try and have an attorney prepare this as opposed to doing it yourself is because issues of elder financial abuse right now are very much on the rise, and durable powers of attorney for financial matters are one of the main legal documents that are being inspected right now to make sure that what's being prepared is appropriate. If you prepare it yourself, even if you're totally right and do everything you think is appropriate, you can be at a place where you have to defend yourself. If you have an attorney prepare one for you, the attorney's liable. So it's our recommendation that these are very specific forms that you do not prepare yourself.
Stick around. Don't go too far. Because the next question is, if a person has to cut back work hours due to caregiving, are there any financial resources available from the government? And if so, how does one apply for this? Do either of you want to take it, or should we just give the mic over to Esther?
I would say there is the Family Leave Act, and I'm not that knowledgeable about the Family Leave Act, but I definitely think if you're a Googler, to Google that, talk to maybe an attorney, your HR person, and if I was at my computer, if you were calling me about that question, I would help you kind of walk through that, but I can't do it off the top of my head, but there is the thing called Family Leave Act.
And Esther said, you're right.
Yeah.
For those of you who meet income requirements, and that's poverty under $2,000 in assets and limited income, there are in-home supportive services, and it's generally done by family members. You have to qualify again. They're means-tested program. Most of them are done by family members. Betsetic Legal Services is another great resource. I don't have the number offhand, but it's easy to find. There's probably somebody here. You do? Great.
Someone in the audience just handed me the number for in-home support services. Thank you. And the number is 213-744-4477. What a cooperative group we have.
Did you all get that?
No. Do you want the number again? 213-744-4477. In-home supportive services.
Thank you, Judith. I'm having Esther stand by because the next question is, why do you need a conservatorship for $5,000 if you already have the power of attorney?
Esther, do you want to answer that? I think you could do a better job.
Well, the answer to that is hopefully you don't. The whole point of a power of attorney is that you're saying while you have the ability to make your own decisions, who you would choose to represent you, who knows you. Hopefully you'll talk with that person, you'll discuss what those issues will be. I know our organization is a nonprofit. One of the booklets we put out is called Your Way, which is that questions and answers you can ask for yourself and decide just to discuss with those close to you. Should you not be able to decide for yourself, what would you want that person? Your agent is your representative. Hopefully you have this done, you don't need a conservatorship at all. What happens if you don't have this prepared and it's time and somebody needs to make decisions for you, if people here were to guess under California law, who has the right to decide for you? The answer is nobody. Your husband or wife doesn't, your parents don't if you're an adult. There is no legal right to make decisions. So having that prepared is an option instead of having to rely on conservatorship court. Right now, filing fees alone in conservatorship court are an average of $900 when there's no contest. And the time limitation is incredible. So having the powers of attorney does not mean you will not go to court. It means if there is an agreement and there's no dispute, then court's just not necessary.
Thank you, and thank you for being here. Okay, next. How would you suggest approaching a parent with dementia who has a very controlling personality, doesn't think she needs help, doesn't want help, and refuses to cooperate, but can't do anything for herself?
You want to start first?
No, you can start.
Okay. That's about, 40,000 people with dementia out there. What you need to do in this particular case is, when people get so obstinate and they're so angry, it's because they often feel like they are out of control. They're trying to stay in control by refusing to have help, to let anyone work with them, to leave their homes. If they are not deemed incapacitated, there's not a lot you can do with that kind of personality until something usually happens, honestly. But there are ways of dealing with this by helping the person behaviorally feel like they are getting back into control, to work with them. Sometimes the abstinence is because they're going to say no for everything everything that you ask or everything you're suggesting, because they want to have control and they have none. It's kind of an individual thing. I personally would have to sit and ask you more questions so I could give you some suggestions rather than an overall. What would you say, Nicole?
Same as you, Judith. I would want to know a little bit more about this person. You might want to, if they're not responding well to you as maybe the adult child or the spouse, you might want to bring in somebody with a little bit more authority. And again, I go back to my age. I look very young, but if you put me in a room as a professional, and I have that conversation with that loved one about, your loved one's very concerned, and why don't we think about getting you looked at, and what about making an appointment? Sometimes coming from another perspective, not somebody so close or professional, kind of works well. So that's one sort of technique that you could use as well.
Esther, this could be another one where we need your help. I'll read it, you listen, and then you decide. Okay. I'm assuming this is, again, an assisted living question. The food is now bad since the cook is gone and the housekeepers are cooking. Is this legal?
My one response, without knowing a ton of information, is that if you're not happy with your assisted living for the cooking situation, or the activities aren't great, or any kind of staffing issue, there's the Ombudsman Program. And the Ombudsman, what they do is they represent the families and the persons in the facility, and they come out and they try to work through issues so that you don't have to necessarily hire Esther, because she could be a little bit more expensive, but they could kind of work some of these things through and kind of get a dialogue going. So that's the route I would suggest taking.
And I'm also going to say, again, if you've worked with an agency, go back to that agency, register your complaint, and they will work with the community to try to rectify the problem, and they will appreciate your input. And then when it comes from the agency and they're going to the community is going to listen because they want further help.
One minor note, everything you said was totally correct, except no one will hire Esther. Esther is representing a nonprofit organization that just provides information and classes to people so that they can take charge themselves.
Thanks, Esther.
And that is so true. Okay, this is our last question, unless anyone has more to hand in.
Okay, my dad is 94. He's at a home. And in the middle of the night, he'll call and saying, oh, I'm having breathing problems. I need you to come and be by my side right now. And this happens frequently during the week, in the middle of the night. And I'm looking at this as his game of enabling. I used to be a kindergarten teacher, so I know the game. The children, when they want attention, this is how they do it. So my thinking is, or the question is, how do you work with your father in this situation? What happens? I'll go the following day, and he's just fine. He's with his buddy or with the wife, and things are fine. So couple nights later, same thing happens. This time there's another problem. Well, I can't move because, I had a stroke on the left side, and I can't do this, and this is going bad, and that's going bad. And it's the same story every time. And then finally, the following day, he'll say, I don't know why I'm waking up every morning. What can we do about this? I said, we just have to leave it in God's hands. And so, is there another way of working with my father?
Well, he's scared. Even with his dementia, obviously, it's very obvious that he's very frightened. Is he in a board and care or in an assisted living?
Assisted living.
Assisted living. So you can't be, he has his own phone, you can't be sure that somebody is really watching him at all times if he's not coming out of his room.
Basically, what this gentleman was asking or saying is that there are people there at night, but they're little women, small in stature, and they are having maybe a hard time redirecting him and kind of helping him. So I have a sort of a response, but I don't know if it might be too much to get into in this kind of setting. But I would say that you need to have a conversation with the assisted living and really bring them into that your dad is calling at night, and it doesn't seem like it's dire. He's not in the process of dying at that moment, and it is disruptive to you, and of course you want to be there for him, but that they need to, you're paying to have him stay there, so you need them to do their job and help manage him when he's having these fearful moments so he feels safe. That would be number one, is communicating with them with what's happening so that they can kind of help problem solve with you. The other thing is I'd really encourage you to visit frequently so that and it sounds like you are, but be there, be a presence in his life so he knows that you're there for him, and that he's not hopefully calling late at night. And I think it's also just continuing to work with people like Judith and I to kind of come up with solutions. We don't necessarily have all the magic wand answers. Maybe even being in a support group where you can throw these things out there to other people who are in support groups. I lead support groups, love them. So that's a good idea. And Bunny has something that I'll repeat. This one is mine. Oh, go the mic, Bunny.
I'm going to suggest to you all when you go out and you pick up all of the wonderful information that both Judith and Nicole have brought you, to also make a round of all the tables, because there are so many resources out there, and be sure to pick up these two directories, the Emeritus College Senior Resource Directory and Community Connections for Older Adults. So much information in these two directories for you.
Yeah, how many of you have had small children? Okay. For many of you, there's a new lingo. There's actually a new word, and it's called Ferberize your child. Anybody hear of Ferberizing your child? And it's really addressing the sleep problems. And kids, and I think Judith and Nicole said so clearly that your dad is afraid. We know that. And I know when my son was young, and it's sort of before Dr. Ferber coined it and made $1 million, I had a mat in his room. And when I knew he was going to be scared, or when he cried out, I actually slept on the mat for a while till he fell back to sleep. Since you know that and it worked, and I didn't take him in bed. That's one of those Ferber things. Never take your kid to bed. And one of yours is never run down there in the middle of the night, or you'll never get out. But what you can do, if there are staff there, know your dad's scared at night. If you can keep track of the time, like, gee, he gets up at 2 o'clock in the morning, anticipate it. And maybe at 1:45, they go in and not just walk in and say, what's the matter, are you okay? But actually lay down and stay with him till he falls back to sleep. I think it just makes sense. And they are on staff, and if you do, as Nicole said, talk to the staff, you can anticipate. It's sort of like taking medication before the pain gets too bad, then totally freaked out and having to call 911 and then direct them. So that would be my suggestion on it.
Thanks, Bunny.
Thanks, Bunny. We have one last question, and the timing is perfect because we've come to the end of our allotted time. So here we are. If there is no placement agency in place, is there any oversight of the assisted living communities other than Ombudsman or Department of Social Services?
If there is no,
If there's no placement agency, if they're not going through a placement agency and they have put their loved person into a senior board and care or assisted living, is there any organization other than Ombudsman or Department of Social Services that does an oversight of the assisted livings?
I do not know. I only know Department of Social Services, and then for skilled nursing, Department of Health. And I'm not familiar with anything else, but if anybody else in the audience does have other ones, yell it out and I'll repeat it.
There is a number, and it's under licensing that you can call, and they will look up every record of every assisted living community, show you all of the dings on their record. It's a little scary because there is no community out there that doesn't have them. So I just advise you, if you are going to make the call, to understand that. So, and it's through licensing, exactly.
It's through licensing, so it's through the Department of Social Services.
It's through licensing, and Bonnie's absolutely right. There are little dings and there are big dings, so take it with a grain of salt. But they can provide that information for you. And every assisted living, every board and care is licensed under Title 22, and that is their oversight. That's the big one, that they have to abide by all of the requirements that Title 22 requests of them, not requests, requires of them, and they get visited by licensing in order to keep their doors open. So other than what Bonnie said, and Department of Social Services and Ombudsman, there pretty much isn't anything else. Those are your big ones.
Esther has one comment about that, so does Bunny, but Bunny, go up to the mic.
Another organization, though, that is really excellent about this is called California Advocates for Nursing Home Reform. They're a nonprofit organization who started out with a specialization in figuring out people's rights in nursing homes, and so they're like a legal aid for nursing home care. They're very much involved in licensing issues. If you go to their website at canhr.org, they have a listing of all complaints against all nursing facilities in California, and you can call them specifically at their 800 number, and they'll talk to you about any complaints you have.
Thank you.
Someone also just gave us an 800 number for, I do believe, it is the City of Los Angeles Department of Aging. Okay, so here's the phone number for that. 800-510-2020. That's 800-510-2020, and that's the Department of Aging.
The next number you all have, and it's your own number. And I think this system isn't perfect. And none of these numbers, then maybe they can respond and take your complaints and you can move them. But it really is family responsibility, I hate to say it, to be proactive on this. As my friend and buddy Paula said, bring them candy, bring them flowers at every occasion. Squeaky wheels get oiled. If you're 200 miles away, like Judith was, then there's a profession that I belong to, professional geriatric care managers, and this is what they do all over the country. So they are there to be out of town, bringing the flowers, working at the problems, and working before they get big. And if it's so bad, then you have to check it out and move it and be proactive and make sure you understand. It's really hard. Sometimes you don't make the right decision. It's the wrong place. And it's the National Association of Professional Geriatric Care Managers, and it's www.caremanager.org. And that's our profession. That's what we do to help, partner with families. But it really is the families. And Paula's right, and she's a pro at it. She gave lots of candy and lots of flowers when her mom. And she had a mother. And she had a mother. So, and she knew it really does help. The more you're there, the better they are. When you come in at 7 o'clock at night, and make sure that they're taking care of business. I'd come on the late shift to visit. Everybody's there in the morning. Yeah.
Every night I get an email. This is honest to goodness truth. Every night at 10-something I get an email. 1-800-FLOWERS. There you go. That's your number. 1-800-FLOWERS.
Also, as a public health nurse, I probably have been to many of the facilities that you were mentioned. For people who also stay at home and care for their patients, families at homes, they're also like, for your problem of staying 200 miles away, there are like nurses, case management in your area, in your parents' area, that could have go and check out the problem, deal with the crisis, then report back to you. You know that? There's a lot of that going on, but it's a private pay, but many of people like networking of nurses who do that kind of services for people who need those kind of services. And, I think you can just Google it and look for RN case management, okay?
There are a lot of resources. I think you should leave with that, is that there are a lot of resources out there to help you when you're caregiving. So take advantage of them.
We thank you all for coming and spending part of your weekend with us, and especially we thank Nicole Feingold from the Alzheimer's Association and Judith Delaney, marriage and family therapist from Pacific Palisades. Thank you, ladies.
Program was recorded at the Santa Monica Public Library and is brought to you in collaboration between the library, the Friends of the Library, CityTV, and the California State Library. That's a wrap on another episode of Cool People, Places, and Things here on the West Side. For CityTV, this is Lee Ehrenberg. We'll see you next week. Bye-bye.
Great job, Lee.
Is that a cut? We got it? Okay,
We got
guys.
what we
All right, thanks. See ya.
Hey, where are you going?
I got some personal business to take care of. Come on, guys. Stop rolling, okay? I agreed to do a reality show about hotspots in Santa Monica, but I can't let you follow me to my living room.
Lee, it's a library. What's the big secret?
The big secret is that at Santa Monica Public Library, what you see is not just what's on the shelves. All right, it's against my better judgment, but let's, as they say here at the old biblioteca, let's check it out.
Wow,
I told you.
this place is incredible.
Isn't it? Yeah, it's got a super high green rating. It's Wi-Fi throughout. So the space actually feels alive, like a living room.
Hey, Lee!
Hey, what's going on, guys? How are
Back
you?
again.
Yeah, I'm always here, dude, huh?
Oh, did you get our tweet?
Yeah, is it 3 o'clock?
3 o'clock in the auditorium.
All right, dude, I'm gonna see you there, okay?
All right.
Later, later,
Bye.
bye.
Friends of yours?
No, those are librarians.
No way.
Yeah, they're all super cool. I even friended them on Facebook and I follow them on Twitter. That's how I know one of my favorite authors is speaking at 3 o'clock today in the auditorium. Hey, you wanna grab a coffee and check it out?
Coffee.
Right this way, Miss First Time at the Library.
Oh,
It's a good latte, right?
That's my line. Can I at least have two
oh.
words?
I'm sorry, what, are you criticizing the writer?
No,
I
but
don't
I mean,
think
you had
you're
a
lucky to be in
paragraph.
this if you weren't good looking. Seriously. Heather, we put a lid on these. We can go inside, we can check out the latest CDs, DVDs, bestsellers.
Yeah,
Cool.
that's great for you, but I don't live here. I live in the South Bay.
Do you got a California driver's license or a photo ID?
That's it?
That's all you need for a library card.
I'm out of here.
What? Where are you going?
Get my library card. Dwayne, let's go.
Are you going too? Ah, great, there goes the neighborhood. Hey guys, welcome to the It's Cool to Be Smart Club. Why don't you join the happening at Santa Monica Public Library, where the brains meet the beach at 6th and Santa Monica. Check us out today.